So let's talk a little bit about treatment. I know we talked before and you mentioned that stroke, it was the most common injury, right?
Mm-hmm. Mm-hmm.
So could you just tell a little bit, how is the treatment in the different settings?
For sure. Stroke is the number one neurological condition that our hospital sees. Cardiovascular disease is the number one leading cause of disability and death in America. And, we see it more and more, especially now with COVID. We see patients that have had diagnosis of COVID, but also have the stroke and different conditions. So when it comes to stroke, or cerebral vascular accident, CVA, there's typically two types of stroke people refer to: ischemic stroke and hemorrhagic stroke. Both of them end up with lack of oxygen to the brain. Okay, so ischemic stroke, you're going to have a blockage or a blood clot that's limiting blood and oxygen to the brain. Or you're going to have hemorrhagic stroke where they're bleeding out and you have blood going elsewhere, but just not going to the centers of the brain that need to. So depending on the area that has that lack of oxygen will be what their impairments will left with. Typically, if you have, impairments or a right-sided area where they had the stroke, you have left-sided weakness. Then you have sometimes strokes where there is more involvement in the brainstem or the pons area, where that gets a little bit more serious and the survival rate gets a lot less because of the fact that those are crucial areas of the brain that take care of breathing or cardiovascular system, your heart rate, and those kinds of things. One of the common, I wouldn't say common, but within that severe stroke that we see are patients with locked-in syndrome. And locked-in syndrome is when patients have a stroke within an area of the brain cell called the pons, and that individual has many times presents with limited or no movement in any other muscles besides the eyes, and they only communicate with the eyes. So let's take, for example, a patient like that, right? They have no other movement but the eyes. So that's going to be a very dependent patient. They're going to be dependent on caregivers, on clinicians to help them, whether it's to teach families to, okay, you need to turn this patient every so often in bed so they don't get bed sore. You need to learn how to transfer this patient from the bed to their wheelchair, either physically and safely so you don't injure the patient, you're injured as well, or to use devices like a Hoyer lift where you teach them how to crank a Hoyer lift, or you have to order equipment for them so they are safe to use that equipment and they don't risk any injury. Other things you're teaching this kind of patient is getting in an upright position after a serious injury. And many times if you're bedridden, just your cardiovascular system is not regulated enough so you can sit upright, right? So those are things that we want to slowly start to emphasize and teach the patient so they can have somewhat of a meaning for life and they're not stuck in their bed the whole life. So then we have, that was talking more about severe stroke and how dependent patient are. Then we have mostly what we see is a patient that has that one-sided weakness. Now, the one-sided weakness can be also known as hemiparesis or hemiplegia. If it's completely paralyzed, we call it hemiplegia. And with hemiplegia, we're teaching that patient how to figure out how to compensate, whether it's getting and rolling out of bed, getting up and down from a chair, walking, and giving them proper equipment, whether they need a walker or a cane, or they need supportive devices such as an orthotic for their ankle. And you're also teaching family, right? Safety is the key here, with safety while you're improving their balance, while you're improving their strength, while you're improving their endurance. Those things are very common. So we're taking care of the whole patient and their dynamic. So we listen to their family dynamic. We listen to how their house is set up. We listen to whether they have stairs or they're just having a single level they don't have to worry about. We might even teach families how to, if they can't do stairs, how to teach two family members how to take their wheelchair up the stairs one step at a time. So a lot of education goes into these kinds of sessions for both patients. And we want to ultimately, we want to make sure they're safe to whatever setting they go to next, whether it's home, whether it's at day rehab, whether it's at a nursing home. Some patients don't have family members, or their family members are older or not as supportive. So their next level of care isn't the inpatient rehab, it's maybe a nursing home, right? Or a skilled nursing facility. And we want to make sure they're safe for wherever they're going next. And then you have, the minor stroke or a mini stroke, transient ischemic attack, or like a little, or a cerebellar stroke where they're working on more balance and they have ataxia of movement. So there's broad ranges, and we treat impairments, right? Regardless of what their stroke is, we treat what their impairments is. What they present in front of you with at that time is what we treat at that moment. So that's a little bit of a summary.